Hi, everybody. This is Louise from O'Neill Marketing. Welcome. Today, we want to welcome all of our agents as well as our presenter, Taylor Davis. And Taylor is from Ameritas. He will provide an overview of the vision and dental plans that they offer. And he will outline the costs, the network, and the enrollment platform. The slides from this presentation will be shared with you via email later on this afternoon. And after Taylor presents, we will have time for questions and answers. So if you want to type any of those into the tab over on the left, please feel free to do that. With that, Taylor, I will let you take it away.
Thank you so much for the introduction, Louise. And thanks everyone for joining. Hopefully you're having a great start to your 2022. I can't believe we were just talking, Louise and I were talking about how quickly this year's already going by. It's the 20th of January, and before we know it, it's going to be summer, and we're going to be right back in the thick of things with open enrollment and AEP. So hopefully you guys had a great AEP and open enrollment of 2021, and looking forward to a great 2022. As Luis mentioned, if you do have questions, we'll get to those at the end. Hopefully I answer a lot of those throughout this presentation. But again, put in those questions. We'll get to those at the end of the webinar. As Luis mentioned, my name is Taylor Davis. I'm the Regional Managing Director here at Ameritas over the dental and vision aspect here at our company. There's a lot of things that I want to go over, but first of all, here at Ameritas, we pride ourselves on being a lead competitor in the individual dental and vision space through our no waiting periods, next day effective dates, largest network in the industry, and ease of enrollment. Those four things really make us stand out from the pack. And while I go through all these scenarios on why Ameritas is the number one individual dental and vision product out there, I like to start off with why dental and vision to begin with. Out there in the marketplace today, you might be focusing on life insurance, Medicare, maybe even PNC. It just depends on what your niche is that you're currently covering. For me, I think dental and vision is one of the best products out there to offer a client and to talk about. Just to give you some quick information on how many clients are looking for dental and vision, about 7 out of 10 clients over the age of 65 or about to retire, 7 out of 10 of them are looking for dental and vision. 25% of them, about 30% of them, don't know where to purchase or don't know how to purchase that individual dental and vision. They're used to having that group policy, and once that comes around, wherever they work, they're used to clicking dental and vision and just having that group policy. On the individual side, as everyone knows, things get a little bit different, right? How do I enroll? Where do I look for dental and vision? What dental and vision product's the best for me? And I think here at Ameritas, we do a great job on simplifying that process through our product itself and also that enrollment process. So dental and vision to begin with, maybe you're not offering it today. Maybe you're looking to offer dental and vision. Maybe you are offering it and you want to look into Ameritas. I think the demand for dental and vision is huge. And I think that demand helps your business huge. The demand there on the referral basis of the product, again, your clients purchasing dental and vision to use it. They're not crossing their fingers hoping they don't have to use a dental and vision plan. They're purchasing it to use it. So they're going to talk to their friends, their neighbors, whoever it might be about, wow, look how great this dental and vision product works. That referral base is going to grow. Also the persistency, right? Be that one-stop shop. Offer every product you possibly can. Talk to them about it, especially dental and vision. It's an easier conversation, right? People understand dental. They've had it probably in the past. So the more products you have with that client, the better persistency you're going to have as well. Also adding value to your clients' lives. As I mentioned before, our product has no waiting periods, has next day effective dates. So we want to add that value as quick as possible. We want to also give you the tools to be successful. That's why our enrollment process is very, very simple. We also want to grow your reputation, grow your business, grow your commissions. So switching gears to why dental and vision, why you should offer it, right? You got the referral base, you're adding value to your clients' lives day one. Now let's switch gears to why Ameritas. Why do we stand out from the pack? Why should you be writing Ameritas? Why should you get contracted with Ameritas? We focus on a lot of different things when we do launch new products. We look at our plan every year. and we look at the competition, and we again, we want to continue to be at the peak of this, the realm of dental and vision aspect. And we focus on creating that economic value. As I mentioned before, creating that economic value, adding value to your clients' lives day one with the no waiting periods, next day effective dates. We want to add that value as soon as possible. We also want that product simplicity here at Ameritas. We don't want to offer 15 different plans that each one has a little bit different tweak to it. We here at Ameritas have 3 plans, and each one of those plans kind of have a specific niche to what client you're talking to. Maybe a client's looking for a hearing benefit with their dental. We have that. Maybe someone's looking for LASIK or teeth whitening. We have that as well. Or maybe someone's looking for more of a value plan, a little bit cheaper plan. Maybe they're looking for just preventive services or basic services. We have that plan as well. So we want that simplicity aspect to be there for our products. And next is our network. I'll be talking a ton about our network. The thing about dental in general is someone really can't mirror a network, right? If you're selling another plan out there, they can't mirror the Ameritas network. We have one of the largest in the industry. I'll go over all that information here in a little bit, but when it comes to dental services, network's super important. On average, our network savings are about 30%. So without even talking about the product itself, you're saving that client about 30% by just going into the Ameritas network. And last, and certainly not least, is our ease of enrollment. I think when it comes to that first impression with a client, talking with the client through a product, and then when you get to that enrollment process, it has to be simple, right? We don't want a paper application. They just sit there and write down all their information and send it into us via, email or fax. We want a process that they can sit down, either you or they can enroll themselves as well. We don't ask for a social security number. We don't ask for an e-signature. You can do a credit card payment. You can do ACH. There's a lot of different things that you can do with our enrollment process. So once you do get contracted with us, and maybe you're contracted with us today, what happens is we send you a personalized hyperlink, and that's how you quote and enroll the clients. You can put that personalized hyperlink up on your website. You can send it out to your client base. Maybe you haven't been offering dental and vision in the past. You can send that email out to your clients and say, hey, you just got a great new product in dental and vision. Take a look at it. You can enroll yourselves. Or if you need help, I can help you enroll as well. So it's very, very important, I think, on that sales process, on any process, that enrollment has to be simple. We do have nationwide coverage. We are in all 50 states. We do have some state specifics. You'll see those in the gray. If you do focus in some of those state specific states, I can send you a brochure on those states. Or also you can go to explore.ameritas.com/agent marketing. I'll tell you again here in a little bit. I'll have a slide that goes over that website. But if you go to that website, you can pull actually those brochures off of there as well. Most of the states have our generic plans, the plans that I'm going to be going over today. Those are in the dark blue. You'll also have a little bit state specifics in the light blue states. You'll see Texas, Kansas, Missouri, Illinois, Kentucky, and Connecticut. They just have little state variations in those states. They're pretty similar to the 3 plans I'm going to be going over today. So really the ones that stand out the most are Washington, New York, Ohio, New Jersey, Georgia, Mississippi, and Louisiana are the ones that maybe you might have to look at the brochure a little bit to see what those state specifics are. But again, we are in all 50 states. This comes in handy with our enrollment process. So once you do get contracted with us, again, you have that hyperlink. You don't have to worry about, oh goodness, I just sent that hyperlink off to someone that product's not available in that state. Here at Ameritas, all 50 states, so you can feel comfortable sending that hyperlink out to all of your clients, no matter where they are. And again, they can enroll themselves as well. So the 3 plans that we actually launched middle of last year, kind of different for us. Usually we had about 1 or 2 plans that we would have per year. We kind of wanted to go a little bit different. Last year, June, is when we launched these 3 plans. We wanted products that really fit each person, right? Like I mentioned before, we wanted a product that has a hearing benefit. We wanted a product that has increasing maximums. We want a product that also has LASIK and teeth whitening. And then also a product that has that low cost, around that $20, $25 range. So with PrimeStar Total, this product, as I'll go through it, is more geared towards the over 65. All of our plans, all three of the plans are 18 and older, but you'll kind of see how it fits in that niche as I go through it. The maximum benefit for PrimeStar Total starts at $2,000 day one and increases to $2,500 in year two. Preventive Plus is included with this plan. Preventive Plus is covered in all three of our plans. What Preventive Plus means is preventive services do not go towards the max benefit. I imagine I probably have some Florida agents on here that sell in Florida. Unfortunately, Preventive Plus is not available in Florida. So just keep that in mind as well. Preventive services do not go towards the max benefit when Preventive Plus is included. Deductible, $0 for preventive, $50 for basic and major. Preventative services are covered at 100% day one. So again, you're talking to the client, they go in to get a cleaning tomorrow, we'll cover that at 100%. Basic services are covered at 80% day one, jumps up to 90% in year two. Majors covered at 20% day one, covered at 50% in year two. Again, major services, that's implants, dentures, crowns, all that stuff is covered day one. You're talking to your client today, tomorrow they need to go in and get a crown. We'll pay 20% of that. And also, if they go in network, they're going to get that negotiated rate or network discount as well. So that's why the network plays a huge part in all dental products. Going in network saves that additional money. We also have a hearing aid benefit on this plan and an exam, $75. Again, it's no network for the hearing benefit. Wherever they go, they can submit the claim to us. We'll pay up to $75. Hearing aid benefit per ear, $200 day one, $300 years two, $400 year three. So as I mentioned before, this product is, again, more geared towards that over 65 hearing benefits, a little bit higher on that maximum benefit as well. But again, 18 and older. Someone can be 19 years old and have this plan as well. PrimeStar Access, same thing. With PrimeStar Total kind of going more towards that over 65, this plan is probably more geared towards the under 65. Again, our products are 18 and older. Someone 100 years old can have this plan as fit on PrimeStar Access. It starts off at $1,000 day one, jumps up to $2,000 in year two. Preventive Plus is also covered with this plan as well. Again, preventive services do not go towards the max benefit. Deductible, $0 for preventive, $50 for basic and major. Preventive services are covered at 100% day one. You will see with this plan, again, PrimeStar Access is a little bit cheaper than PrimeStar Total. So with a little bit cheaper plan, if they do go out of network, those co-insurances do change. PrimeStar Total, if they go out of network, the co-insurances do not. PrimeStar Access, they do. Again, preventive services are covered at 100% day one. You'll see also that out of network underneath there. Basic, same thing. 65% day one, jumps up to 80% in year two. Majors covered at 20% day one, jumps up to 50% in year two. Again, no waiting periods, next day effective dates. You're talking to a client today, tomorrow they can go to the doctor and get crowns, dentures, implants. We also have child ortho on this plan. Again, more geared towards that under 65. Child ortho under age of 19, lifetime maximum per person is $1,000. We start off at 15% day one, jumps up to 50% in year two. We also included a LASIK benefit on this plan, $125 per eye, years one and two, $250 in years three plus. So again, as I mentioned, all of our plans are 18 and older, but you'll see with the teeth whitening, the LASIK, the child ortho, all that kind of stuff is probably more geared towards that, 40 to 50-year-old. But again, someone 100 years old can buy the PrimeStar Access plan. We just wanted to make plans that might fit different demographics. So again, PrimeStar Total has the hearing benefit, a little bit higher on the maximum benefit. PrimeStar Access has the LASIK, the teeth whitening, and the child ortho as well. PrimeStar Value is the cheapest of the three plans. You're looking at that $20, $25 range with PrimeStar Value. Something different we haven't done here at Ameritas is really have a value plan. I like this plan for if someone's in between jobs or if someone's budget is in that $20 range. Or if someone's like, hey, I don't really need any major services done. I like PrimeStar Value. I need preventative. I need basic services. The maximum benefit for PrimeStar Value is $750. Preventive Plus is also included on this plan as well. The deductible is same as the other two, $0 for preventive, $50 for basic and major. Preventive services are covered at 90% day one, jumps up to 100% in year two. Basic is covered at 50% day one, 80% in year two. Major is covered at 15% in year two. So again, someone in between jobs, their budget is in that $20 range. This is a great, great product for them. Our plans theoretically are pretty split down the middle with what we write today. Probably PrimeStar Access gets most of the business. PrimeStar Total and PrimeStar Value are probably tied for second place. But just to give you an idea on agents are really selling all three of the products out there in the market today. There's really not one that gets more attention. All three of them are great plans, but really cover a different niche on each one of them. So why is network so important? I've talked about it before already. Something you can't mirror out there is the Ameritas network. There's a lot that goes into our network, and a lot of people work on our network and work on it to be the greatest in the industry. There's a lot that we look at, like network persistency. A client might ask an agent, well, what are the chances that that in-network provider that I told my client they can go to leaves the network? Our network persistency is about 99.5%. So if they're in our network today, they have almost 100% chance that they're going to continue to stay in our network. So that network persistency is great to have and great to know. Contracted fees or negotiated rates, anywhere from 25 to 50% on contracted fees or negotiated rates. So we partner with those providers who give the best negotiated rates. If a provider comes to us and says, yeah, we'll give you a 5% contracted fees on crowns and dentures and stuff like that, well, that's really not offering that economic value. We want to partner with those providers who are bringing that economic value to the client. So again, our average is hovering around that 30% marker on that contracted fees. I'll go over a great illustration here in just a little bit to really show you what it means by having our product and our network at the same time and those savings that come along with that. There's no balance billing by going in network, right? If you go in network, all the claims forms are submitted electronically to us, and there's no balance billing to that client. If they go out of network, they could be balance billed, just depending on that out-of-network dentist. Also with that out-of-network dentist depends on how they submit the claims to us. Some of those non-network dentists submit them electronically to us. Some of them ask the client to submit them to us. We just don't really have a say in what those out-of-network dentists do. But our in-network dentists submit the claims forms electronically to us, so they never have to that customer never has to touch a claims form. Overall, just great customer experience, right? You get the savings, you get the not ever touching the claims for you, no balance billing, all that great stuff. Just overall has great customer experience. Ameritas Dental Network. In the past year, we've grown about 70,000 access points nationwide. We're committed to growth, but as I mentioned before, we're committed to strategic growth. We want to partner with those providers who give the best negotiated rates. We're anywhere from 25 to 50%. Our average is 30%. So again, we want to partner with those who add the best economic value to that client. We're currently hovering around that 590,000 access points nationwide, and we have more than 130,000 unique providers. An access point is the actual brick and mortar location where a client can seek dental services. Inside of those are the actual dentists, the unique providers. Last I read, there's about 180,000 dentists nationwide. Just shows you how large we are. We have 130,000 of those. Access points nationwide, 590,000. It's a large area that we cover around the U.S. So here's the great economic value piece that I mentioned before, the illustration that shows you, what happens when you purchase our product and also go to an in-network provider. And actually, this piece right here is on that marketing website I was telling you about. I'll go to the slide here in just a little bit so you guys can write down that URL. But on that marketing website, we actually have this great economic piece for each one of our plans: PrimeStar Total, PrimeStar Value, and PrimeStar Access. So if you're talking about a plan, you can actually grab that one and use that specific plan to show them a hypothetical illustration. This is a pretty spot-on illustration with regards to the average cost that a provider has for a crown, dentures, and all that kind of stuff, you can actually go to our website as well and look at what the average cost is for a crown, denture, all the fillings, even preventive service as well. You can go to our website, type in a zip code, and it'll show you what that average is in that specific zip code. That's exactly what we did on this hypothetical illustration. Actually, I have a Minnesota zip code that I typed in, and it showed what the average cost is in this Minnesota zip code for a crown. So the purple is for major, the blue is for basic, and the gray is for preventive services. So let's look through this and really show how the product works. I think it's great when we put things on paper. Actually, I have a lot of clients I have a lot of agents who take this, laminate it, and take it with them when they do talk about dental and vision. Again, putting things on paper is fantastic. We do it on annuities. We do it on life insurance. We show how a product works. Same thing for dental. You want to see how that product really works. Because as I just went over those 3 plans, as a client, you might be like, okay, well, how does it really work? Like, can you show me on paper? And this is exactly that. So with a crown, again, I looked at a specific zip code, actually in Minnesota. You can type in, if you're in Florida, you can type in zip codes out there as well. And I typed it in, and the average rate for a crown in that specific zip code is about $1,400. So if they have no insurance at all, they're going to be paying around $1,400. Again, when we go through this is going to show you that referral base that I was talking about. A client can go as soon as tomorrow, and they're going to talk about those savings that you provided them through the Ameritas product. The blue, it's for fillings, and then the gray is for preventative services. So they need to go in and get a cleaning. And again, this is all just based off of that specific zip code that you can go into and look on our website as well. So network rate, as I mentioned before, averages about 31%. You take 14 or 1368 times 30%, well, you're already going to be saving that client close to $600, right? So why is network so important, right? You have other products out there that people say, we don't have a network. You can go to any dentist out there. Well, that's the same for us too, right? We want that member flexibility. Maybe a client's been going to a dentist for the past 30 years, and for some rare occasion, they're not in our network. That's okay. We still want that member flexibility that they can go out of network, right? But if they go in network, the savings on top of the product itself is fantastic. So again, without even talking about the product, you're saving that client, again, $565 just by going in network, right? You'll see the blue, that's a filling, and then you'll see gray as well. That's just off of going in network. Then day one cost, right? You do the network plus our product. We cover 20% day one for major, crowns and major. So times 803 by 0.2, 642. So you're saving that client more than half, 53% to be exact, as soon as tomorrow, right? They might have gone in, 5 months ago and needed some crown work done. And the dentist said, well, that's going to cost, $1,300, $1,400. That's a large chunk of change, right? So they might have said, nah, I don't need it right now. If you're talking to a client who's had that conversation or has to have it in the future, and you can save them more than half. Back to my first slide, why dental and vision? Referrals, persistency. You're gonna be their lifelong agent with a product like this. So again, day one cost 642. Let's look at year 2 cost. 803 times 50%, right? In year 2, we jump up 20 to 50%, 402. So whichever way you look at it, whether it's in first year or it's in second year, you're providing that economic value. That's our goal, right? It's providing that economic value. Give them something that they can use tomorrow. No waiting periods, next day effective date, largest network in the industry. Those are all things that you can have that conversation with that client. That's a lot of money to save them, right? Your referral base is going to grow. So switching gears from dental to vision, especially in that over 65 market, there's a lot of increased risk of falls, fractures, depression, identifying medications, bathing, dressing. There's a lot that goes into why vision is so important, right? Here at Ameritas, same thing with dental. We want that member flexibility. So we are the only carrier that offers both IMED and VSP. Now we offer these plans at that point of enrollment. So both of our plans are standalone. Dental and vision are standalone plans. So if a client says maybe they opt out of dental for some reason, that's okay. They can have vision by itself as well, and vice versa, or they can have both, right? So PrimeStar Vision, we get that member flexibility at that point of enrollment by giving them the option to choose IMED or VSP. Today, IMED's a little bit cheaper than VSP. It's around that $10 mark. VSP is about $16. There's really three things that an agent and client talk about when it comes to vision. One is what's their budget, right? We just talked about the pricing. Two is, where they used to going. Are they used to going to Walmart or Sam's Club or Costco or Vision Works? And the third thing is what are the member frequencies? How often do they need eyeglass lenses or frames? So those three things really are what boil down to what that client needs in a vision plan. So IMED, you're looking at Lens Crafters, Pearl Vision, Target Optical for IMED. Again, a little bit cheaper than VSP. So it's a little bit higher on that eye exam, $25 for an eye exam. And then frame allowance is a little bit less than VSP, right? Because it's a little bit cheaper plan than VSP, $130 allowance. Benefit frequencies, as I mentioned before, is that third question you need to ask the client. If they don't need eyeglass lenses or contacts or frames, until every 2 years, well, IMED might be the best plan for them, right? You're just over that $10.50 mark. You have a $130 allowance, $25 for an exam. Then also the eyeglass lens, contacts, and frames is once every 2 years. Of course, the exam is once every year. Switching gears to VSP, you're looking at Costco, Walmart. They have big name recognitions with Costco and Walmart. They added actually Walmart and Sam's Club, I believe, sometime in 2019. So does have big name recognition with VSP, a little bit more expensive plan. So you have a little bit less when it comes to an eye exam. $10 for an eye exam through VSP. Frame and contact allowance is $150. As I mentioned before, it's just over $16 for the VSP plan. IMED was $10.67. VSP is $16.34. Back to my comments about benefit frequencies. VSP is once per year for everything, right? So the differences are where they used to going, right? The three questions: where they used to going, what's their budget, and then benefit frequencies. How often do they need eyeglass lenses, contacts, or frames? So VSP is a little bit more simplified than dental, right? Dental, it depends on what they're looking for. Do they need a hearing benefit? How much are they looking to spend, right? We have the total value plan, all that kind of stuff built into dental. Simplicity wise, we make it as simple as possible when it comes to dental. Vision, same thing. We want that member flexibility. What's their budget, where they used to going, and then benefit frequencies as well. So making it easier to work together. One thing I like to touch on when going through these are member tools, right? I think when clients purchase a plan, they need to know, what else they get with that plan. And there's a lot that goes into, and I know it's just dental and vision, but there's a lot that does go into what a client's looking for in a plan. Also, they have a lot of member tools as well. Find a provider is both for the member and the client, or member and the agent as well. You have access to find a provider, and so does the client as well. The dental cost estimator is what I mentioned before. You can type in a zip code and you can see what that average cost is for dental procedures, right? Crowns, dentures, fillings, all that kind of stuff. You can see what that dental cost estimator is. So if a client does have a question and says, well, I've been needing to get dentures. Well, you can look at that cost estimator and show them, without insurance, here's what it's probably going to cost. And then you can go into that hypothetical illustration that I showed you about how much money they can possibly save by having our network and going with our product. Again, member flexibility, they can go out of network as well, but you've already seen how great the savings are when they do go in network. Also, dental health report card. We do nothing of this. There's no underwriting when it comes to our product. The dental health report card just helps the client know, how well they are doing. Prescription savings card as well, eyewear savings card, and also worldwide assistance. If they're in a different country, they need help booking an appointment, maybe an emergency, they can give us a call. We can help book that appointment as well. Agent tools. This is kind of back to our two things here at Ameritas, right? We want to provide that economic value, and we want to give you the tools to be successful. So if you do go to explore.ameritas.com/agent marketing, right there in the top left-hand corner, it'll take you to our marketing website. We have have blog articles. We have all the network information you can think of. We have social media posts, LinkedIn, Twitter, Facebook, all that cool stuff we have. But also remember, once you do get contracted, we send that personalized hyperlink. That's uniquely your hyperlink. You don't share it with other agents. You don't use other agents' hyperlink either. That is how we connect your commissions. That's how we track your book of business, just through that personalized hyperlink. Now, also, with regards to that hyperlink, you can post that to your Facebook. And you can say, hey, I got a great new product. Your clients can click on it and they can enroll themselves. It actually looks really nice when you do put it on social media. So there's a lot of different avenues you can take with that personalized hyperlink. Again, just adding tools for you to be successful. So we've already discussed this a little bit. The URL, again, it's yours. It's how we track your business, how we track your commissions. So if you're not contracted with us today, don't enroll anyone on our Ameritas website. We don't know what agent that is. If you do book through, or if they do enroll on the Ameritas website, we can't connect it to an agent. So wait until you do get contracted, get your personalized hyperlink, and then that's when you can send it out to your client base. Quoting is easy as well. We're actually zip code rated. We're not age rated. So what that means is if someone's 18 years old and someone's 100 years old and they live in the same zip code, they're going to have the same rate. Our product also doesn't increase when they turn 65, right? There's some products out there that premium wise, once they turn a certain age, those premiums increase. Our product doesn't do that either. We're zip code rated. So once you do type in the zip code, or once they type in the zip code, because they can enroll themselves, what's going to pop up is, do they need dental coverage, vision coverage, and how many need coverage? Again, all the two plans are standalone. If they just need vision, or if they just need dental, that's fine. If they just need vision, that's fine as well. But again, you've seen the need for both dental and vision out there. They can purchase them at the same time as well. How many need coverage? I believe we go all the way up to, I think, 10 dependents. What members will see, or what you'll see if you're sitting down with the agent, or you're in a Zoom call with the client, what members will see are the 3 plans pop up. Once you type in that zip code, we have actually 7 area zip code factors. So we don't have, hundreds of different rates out there. That specific zip code will tell you that rate for it. So what'll pop up, it'll go from, unless we changed it as of recently, it'll go from most expensive to least expensive. So it'll be PrimeStar Total, PrimeStar Access, and PrimeStar Value is what the lineup will look like. We also have a bestseller tab, just kind of tells you what people are purchasing currently. Also in the top right-hand corner on your hyperlink, or once someone does, or you type in that zip code, you can actually share that quote, and they can enroll themselves off of that quote. So just hit that share button and you can send it to them via email, and they can enroll themselves, or you can just send that hyperlink to them and they can start from scratch and go through it. But kind of gives them a head start. If you type in the zip code for them, they'll get the plans and they can just select plan and enroll themselves. Again, wait until you get your hyperlink to do that. Find a provider tool. This is the tool that I said for both the member and the agent. Find a provider tool is very important, right? You want to see what providers are nearby. So a client might put in their zip code and see the providers nearby, or they might have someone that they've been going to for a long time, and they want to search to make sure that dentist is in the network. Go to additional filters, and on that additional filters, you'll be able to type in that dentist name, and then go to it. There's a lot of other additional filters as well. A lot of times I just hit zip code, and you can look in that specific zip code. You can do like a 5 to, I think, 100-mile radius as well. So find a provider tool. All the names that pop up are in network. Whether they're in green lettering or black lettering, they are in network. What the different coloring means is the green just means we want to say thank you to that provider. They give an above average negotiated rate. They went above and beyond. So this comes in handy if a client says, I don't care where I go or what dentist I go to, but I want to go in network. I would choose one of the ones in green, right? They're going to have the most cost savings applied for that client. The ones in black lettering are fantastic as well. Again, we partner with those providers who give the best economic value, anywhere from 25 to 50%. I just want to make sure that you guys know that the ones in green and the ones in black are in network. No one is out of network when you type in this information. You'll receive a confirmation email when someone does enroll in the product. So when this comes in handy is if you do send out your personalized hyperlink out to your in-force book of business and they don't have dental and vision, well, once they enroll, maybe they roll by themselves, you're going to get notified once they do. We're also working on a back office. I'm going to say sometime in February, March, we'll have a new back office that'll have real-time data. That'll show you when a client enrolled and who enrolled and when was the effective date. Today, you really can't see that on the back office, but you do get a confirmation email when someone does enroll. So what's in it for the agent when it comes to dental and vision, and specifically what's in it for the agent when it comes to the Ameritas dental and vision? As always, you have the ability to sell 12 months out of the year with dental and vision. You're not suppressed to the open enrollment or AEP. You can sell it 365 days out of the year at any time of the day, right? Because you have your personalized hyperlink, you can submit it, it'll be effective tomorrow, and then go in and see the dentist. Referrals, leads, as we mentioned before, you've seen the hypothetical illustration. If they use the product and they use it correctly, right? That referral base is they're going to talk about it. 53% savings in the first year, 70 in the second year. Those are big numbers and remain relevant. As I mentioned before, be that one-stop shop. I know we're talking about dental and vision today, but offer everything you can, right? You don't want an agent to call your client who is looking for dental and vision and they say, yeah, I actually do need dental and vision. What else do you have to offer, right? You want to be that agent that an agent calls your client and they say, no, I already have a lot of plans with this agent. I'll call them. Back to that persistency, right? More products you have with that client, the better persistency you have as well. And again, our motto, adding value to your client's life, giving you the tools to be successful, adding to your reputation. Again, we pride ourselves on our no waiting period, our next day effective dates, our largest network, and really our ease of enrollment as well. If you do have any questions along the way, we'd be happy to help out. We have a whole Sales Connect team who takes calls from both agents and clients. So if your client does call you and say, hey, I really need to call Ameritas, you can call Sales Connect team and they can help as well. Sales Connect team is there to help you with your hyperlink. Maybe you're contracted with us currently and you're like, I don't know where my hyperlink's at. You can call them and they'll resend you your personalized hyperlink. It's a great resource to have. So as I mentioned before, Luis, thank you so much for having me. O'Neill Marketing, great organization. If you're not contracted with us, reach out to O'Neill Marketing, get contracted, start writing dental and vision, start saving your clients money, adding economic value to their lives. There's a lot that can really happen with a simple product like dental and vision. So again, I appreciate everyone jumping on here. And Luis, if there are questions, I'm happy to answer them now.
Sure. And if anyone has any questions, please type them in. Right now, there's 2 questions. I'll read them to you, Taylor.
Okay.
Are these dental plans calendar year benefits or yearly benefits starting when they enroll?
Starting when they enroll. So it'll increase on their anniversary. So year 1 benefits, year 2 will increase on their anniversary.
Okay, great. And the next question, you've answered a number of parts of it, but I'll read it. Is there an agent support line?
Absolutely. Yeah. Sales Connect team. And I don't have it on here. Sorry, I don't have the number memorized either. I have their email memorized. It's salesconnect@ameritas.com. You can email them as well, but I'll send Luis the number and all their information. You can also go to explore.ameritas.com. You can click on contact us and it'll have that information on there for the Sales Connect team. But yes, that is the number you do call.
Great. Then part of the remaining part of this question is the network guide online. I believe you said that it was.
Absolutely. Yep.
Are there flyers available and do you charge agents for them?
We don't send out printed flyers. Again, on that marketing website, that explore.ameritas.com, you can go on there and you can download the flyers, send them PDF versions, but we don't actually print them out for you. So no, there's no cost, but you can go on there and get them and have them on PDF form if you want to print them out yourself.
Okay. And then the last part of the second question is, you said the PP is not in Florida. So does that become part of the main benefit?
Yeah, Preventive Plus, it's not part of the product, so preventive services do go towards the max benefit. That's the only change there in Florida. Florida is that the preventative services do go towards the max benefit.
Thank you. Okay, we've got a third question here, and
Okay.
this is going to be a little bit of math for you, Taylor.
Okay, here we are.
Get ready. If my maximum out of pocket is 1,000, the cost of the procedure is 500. You pay 250. I pay 250. What amount goes towards the maximum out of pocket? 500 or 250?
50. It's whatever we pay goes to the maximum.
So that the answer is 250. Whatever they
Yep.
pay goes towards the maximum out of pocket.
Yeah,
What
whatever Ameritas pays. Yep.
Adult orthodontic coverage, is that included?
We do not have adult ortho, just child ortho.
Okay, good. Any other questions out there? If not, I want to thank everyone for tuning in today, and special thanks to Taylor for presenting. It sounds like a great program. I love the personalized hyperlink and sharing the quote button to enroll your client. If you don't have the appointment with Ameritas, please reach out to us at O'Neill Marketing and we can help you get that. Or you can go on your agent portal and request the appointment with Ameritas. As a reminder, tomorrow we do have another webinar at 1 p.m. If you would like to join us, we would love to have you as we continue learning about vision and dental options. So Taylor, thanks a lot. You were really great today. Really appreciate you joining us.
Absolutely. Thank you, Luis. And thanks everyone for joining, and have a great rest of your week.
Sounds great. Toodaloo.